So I hope my screen is visible. Please confirm, Shubhamji.
Yes, sir.
Yes, sir.
Thank you so much. Thank you. So, dear students, I just don't want to take your time. So, I will just tell you what are the answers. I think dermatology overall is very easy in this exam. Only one or two, maybe some students might have felt it difficult because they were not straightforward previous year questions. But otherwise, rest of the other questions are all like standard previous year questions only. So I am also checking out the chart. You can put whatever you are having your queries. So this was a match the following type of question. As you can see here, flaxen, it is seen, it is a pediatrics and dermatology question. So yes, it is kwashiorkor in which you are going to see the flaxen. Auspitz we have discussed this n number of times. It is seen in psoriasis vulgaris. Carpet taxon, it is discoid lupus erythematosus. Derriere sign, it is seen in cutaneous mastocytosis, which is also called as urticaria pigmentosa. Okay, so I hope these were the options. If anything is different in the chat section, please you can type it down. I am watching the live also on YouTube, so I will get to know if there is any queries, right? So what will be the answer here? CADB. So it will be option A. So if you are having any queries, you can post it in the comment section. Right. Thank you so much. Thank you so much. Sure. Okay, one auspit sign with psoriasis was not there. Psoriasis and auspit sign was not in the option together. So can you please confirm what was there in the option, like what was asked? Is there a mismatch in the only auspit sign and psoriasis options? Then maybe they have to give a bonus if at all it is no sir option different. Okay, option are not matched correctly. So if the mistake is on the INI side, they are going to give a bonus if at all no option is perfectly matching. Okay, so we'll go to the next. If there is any bigger concern error in the answer. Okay, thank you so much Vaibhav Jain. I can understand. So in that case, everyone has to get a bonus. There is no other way, right? So this is a next question, syndromic approach, which is not included in the men. So this is basically, we can say common sense question as from the STD. So inguinal swelling, it is a bubo. We are going to use it in the men. Urethritis, obviously, we are going to use it for gonococcal and non-gonococcal urethritis. Anorectal discharge, it is basically male sex male MSM. So it is used in the men. So obviously the lower abdominal pain, which is taken care of by the yellow colored kit, is not going to have any role in the men. Not only that, even the kit number 2, which is green colored kit, it is also not going to have any role in the men. So these are the 2 points which are important for you to remember now. Right. So this is also very frequently repeated question, right? So a man coming with recurrent well-defined red patches which were occurring at the same site on 3 different occasions. Lesions fades after few days and they leave hyperpigmentation. So this type of image was given. So is this the same question and this is the same image? Many students told me that this was what was asked in the exam. So if it was any different, you can put in the comment section. If this was the question, this was the image, you should always think of the drug eruption which is fixed at the same site and it is recurrent in nature at the same site due to the fixed drug. So it is a fixed drug, or in the options fixed drug eruption was not mentioned, so you can put drug induced eruption, drug induced eruption. Okay. So I hope there is no any confusion. These were discussed n number of times in our classes, right? 42-year-old farmer. So this is also very much repeated question, and in fact, related to this subcutaneous fungal infections, we are having 2 questions in this particular exam. So it is very, very important. So farmer, multiple sinuses, and it was mentioned that black colored granules. We have also discussed this in the previous year, 7th November marathon also. Dependent upon the color of the granules, we can differentiate mycetoma into eumycetoma and actinomycetoma. So why is this mycetoma? First of all, because in mycetoma we are going to have a triad of granules, sinuses and the swelling. You can see swelling is there in the picture. It is mentioned sinuses, and also you can see there are granules which is given in the question, which are black colored granules. So it is mycetoma, and it is mentioned as black colored granules. So Black colored granules is seen in Mycetoma. Mycetoma is due to the fungus. And in the options, as you can see here, it is Madurella mycetomatis, which is going to be the fungus which is going to produce this Mycetoma. Rest all the others are associated with actinomycetoma. Okay. Right. If genital discharge, okay, some students are giving something in the genital discharge was the other option. Okay, genital discharge, if it is mentioned, then also it is pointing towards the genital discharge. Was it mentioned? Or ano genital discharge? Was it mentioned like that, or is it mentioned as genital discharge? Okay, I am listening. I am listening. Anorectal not an option. Okay, I have seen that. Genital discharge was mentioned. Is that so, dear students? Yes. Please confirm. Uh, Acha, only genital was given in this particular question. Students are telling that only genital was what is mentioned. Okay, but even then, if it is coming from genital, it could be a ulcer which is present over the genitalia, which could be present in the men. But lower abdominal pain, it is associated with the pelvic inflammatory disease. So it is obviously a disease which is seen in the woman. It cannot be associated with in the men. So that would be a better answer if you have to mark one of them. Okay, I hope it is clear. So I have noted this. Yes, anorectal discharge was not mentioned. Okay, it is only genital discharge which was mentioned. Genital discharge. Right. Any other question? Okay. Acha, urethral discharge. Two is genital discharge. What is that? Dr. K INICET. Options are lower abdominal pain, genital discharge, urethral discharge. Okay. Point noted, but still, if the lower abdominal pain is mentioned, that is not going to be managed under the syndromic approach for in the males. Okay, I hope it is clear. Any other queries? Right. Okay. Ansari is telling in this particular question. So, what were the options? Were these the options which were given, or is there any difference in the options? Okay, Actino Madure is what is given is what is one student is telling. Is that so? So instead of this Actinomyces israeli, I think Actinomadura Madure is given. That's what is Ansari is telling, Dr. Ansari. Am I right? So other students, you can just confirm. Yes, please, dear students, just confirm if that is the case so that I will just make a change in the options. Thank you so much. So it was mentioned as Actinomadura Madre. Thank you so much. But still, it is going to be the answer as Madurella mystomatis, or what is the option C is given as Madurella mystomatis, or anything else was given? Okay. Okay. Thank you so much. I think it is the same thing which is given. So answer is going to be the still the same thing. Right. Okay, this is a next question which students had like in the question they were having many doubts. So please tell me what was there and what was not there. Okay, so histopathology or biopsy image was given, hand drawn image was given like this, something this students were telling. So there was mention of hyperkeratosis and scaly lesion involves stratum corneum, and in the question it was mentioned that the lesion represents verrucae. Okay, and there is some virus which infects the keratinizer squamous epithelium, and they were asking a statement which is true. So is this the question which was asked, dear students? Yes. If you have anything else to add or change, please in the comment section you can ask, you can put that. So it was the image which was showing the virus which is being thrown out of the skin from the stratum corneum. So if this is the case, okay, then you have to think of the human papilloma virus. Then related to HPV, what is the true statement you need to identify? So option A, no vaccine available, vaccine is available. So this is wrong. It is oncogenic virus. Yes, this statement is true. And it is non-enveloped DNA virus. So this is a wrong statement. It is a DNA virus, right? This is a wrong. So answer here is going to be, it's an oncogenic virus. Okay. So in this question, if you have any doubts, you can put in your queries in the comments. And this question, I can say it's like looking like a one liner, but there is a concept behind this. Actually, usually the malignancies are common over the sun exposed areas. So you may think that, okay, this is a melanoma, so we can mark it as a phase. But remember, in the Indian population or in the dark skin individual, it was observed that the most common site is going to be the acral areas, acral melanoma, that is over the palms and soles. It is, we are going to see commonly the melanoma in the patients who are dark. Okay, right. And this is actually a previous year question which was asked. So again, they have repeated, we can say it was INA question itself. So elderly post-menopausal woman, was this mentioned in the question today? Please put your feedback in the comments. Okay, 65-year-old post-menopausal woman, intense itching and soreness in the vulvar region. Examination revealed there is white atrophic parchment-like skin. So these words were described in the question is what students told me, right? White atrophic parchment-like lesion was seen over the vulva. Epidermal thinning and loss of rete ridges and hyalinized collagen. These were all points which were mentioned is what students told me. So what is the most likely diagnosis? So remember, dear students, whenever you get in a post-menopausal woman, a lesion which is intensely itchy in the vulvar area associated with atrophy, then you should think of one condition which is called as lichen sclerosus. The full name, the complete name is actually lichen sclerosus yet atrophicus. It is lichen sclerosus yet atrophicus, which is going to present with intense itching, and there is going to be very, very thin skin. And that is the reason why we are going to see this epidermal thinning histopathologically, right? And these patients should be kept under close monitoring because there is a possibility that they can go into the lesion can develop malignancy, SCC. Okay. Right. So these were the questions which were asked. If you are having any doubts, okay, or anything if you feel is different which was asked, please put in the comments. I am watching the comments, and also you can tag me on Cerebellum Academy official Telegram group and ask your queries. Okay, thank you so much. I hope this marathon and the missions were helpful in answering all the dermatology questions, and I hope you felt the dermatology was easy in this exam. Thank you so much. Just relax. And again, we are going to meet in the in-app version with detailed explanation. Okay, with the changes which you have told. Right. Thank you so much.